Knock before entering the room, identify and greet the resident, explain procedure, wash your hands, provide for privacy.
Hello, Miss Smith. My name's Reva. I'll be your nurse aide today, and I'm going to give you a bed bath. Okay, so I'm going to wash my hands, provide for privacy. Okay.
Fill bath basin 2/3 full of warm water.
So even on your state test, we won't use real water, so we're just going to pretend, but we still have to go through the motions. So I'm going to fill it with warm water. All right.
Raise bed rails. Raise the bed to the best level for good body mechanics. Okay, lower bed rail and position the resident in supine position.
Okay, she's already there.
Cover the resident with a bath blanket and remove top linens.
All right, and again, you can weigh it, the blanket down by tucking it under them. And then I'm just going to fan fold them down to the bottom. I'm not going to fully remove it. All right.
Place the towel across the resident's chest and remove the gown without exposing the resident.
And you can either turn them to the side or just reach and untie it. So now I'm going to just bring it down. It's untied. And I'm trying to do this all under the blanket. And obviously normally you would just put a clean gown on them, but we're just going to put this to the side and pretend it's clean at the end.
Make
Okay.
a mitten of the washcloth and wet with water. Squeeze out excess.
Alright, so for the mitten, if you want to just lay your cloth down on the bedside table, you put your hand in the middle of it, fold it over again, so then it'll look like this, and then you tuck that under. So that gives you a little mitten. Because it is a skill on the step, it's written that way, you do want to go ahead and at least do it that one time. But honestly, when I'm working, I use 4 corners. So I fold the cloth in half and then half again, and then that gives me 4 clean surfaces to use. So since it said to do a mitten, I'll do the mitten. Okay, get it wet, squeeze out excess.
Wash eyes first. Start at the inner corner and work out. Use different areas of the mitten for each eye.
So I'm going to use my pointer finger for the first eye, go inside, work your way out, and then I'm going to use my pinky for the other eye. Alright?
Wash, rinse, and dry the face.
So I can put some soap in now. Wash. And then wring the soap out, rinse, and then dry. Okay.
Wash, rinse, and dry the ears and neck.
Alright, and then it kind of splits it into different steps. But if you wanted to wash the face, wash the ears, wash the neck, then rinse the face, rinse the ears, rinse the neck. That's fine too. So I've washed, rinsed, now dry. Okay.
Expose arm farthest from the side and place bath towel under the arm up to the armpit. Place the basin of water on the bed and immerse the resident's hand in water and wash. Remove the basin and dry hand well.
So washing their hand. Remove it. Rinsed it. Make sure it's nice and dry between the fingers. Alright.
Wash, rinse, and dry the shoulders, armpit, and arm.
Washing. Get under the armpit. Rinsing. And now I'm drying. Okay?
Repeat steps 11, 12, and 13 for the nearest arm.
Okay, so this you can verbalize. So they saw me wash that arm, now I can just say, and then I would wash this arm too.
Place the towel across the chest and fold the bath blanket to the waist.
And this is another instance where it breaks it into different steps. It'll say like wash, rinse, dry the chest, wash, rinse, dry the abdomen. I'm just gonna go ahead and wash all of it, rinse all of it, and dry all of it. So wash. Rinse. And now pat dry. Okay.
It says remove the towel and cover with the bath blanket. And then raise the side rail before leaving the bedside. Change the water in the basin.
So this is the first time we'll be changing the water. So I'm gonna go pretend to dump it, fill it back up, bring it back to the bedside.
Lower the bed rail. Expose the far leg, flex it, and place the bath towel lengthwise under the leg up to the butt. Sorry. Place the basin on the towel and put the foot in it. Support the leg at knee joint with hand. Wash and rinse the foot and leg.
Wash. Rinse. I'm gonna dry. Make sure you get the feet nice and dry. Alright.
Repeat steps 21 through 24 for the near leg. And then it says you can verbalize that.
Alright. So now I would wash this leg. Alright.
Raise the side rail before leaving the bedside and change the bath water.
So that's the second time. So the first time we changed it, we washed the whole upper body. Now the second time we're going to change it, it's after we wash their legs. Okay?
Lower the bed rail and assist resident to turn on the side with back facing the aide.
I'm going to turn you to your side. Alright.
Fold the bath blanket over the resident's side to expose the back and the buttocks. Place towel parallel to the resident's back.
Alright.
Wash, rinse, and dry back and buttocks.
So washing their back. Rinsing it. And then I'm going to pat it dry. Okay?
Give back rub and remove towel and turn resident onto back.
Alright, so this is where you take the lotion, warm it up in your hands a little, and then give a back massage for 3 to 5 minutes. Alright, so I did that.
Raise the bed.
Put the gown on her without exposing her. And I'm tying the back. Alright.
Raise the bed rails, lower the bed, lower bed rails, attach signal light within residence reach.
I'm gonna go ahead and cover back up. The skill is written where it doesn't tell you to cover them back up because it's assuming you're getting them up out of the bed for the day. But I'm just gonna go ahead and put her blanket back on her. Then raise the side rail, lower the bed. Signal lights within reach. Lower the side rails. And then wash my hands and record my observations. And that's where the skill ends. But then like you would have to put the dirty washcloths and towels and everything in the dirty linen, rinse their bucket out, and then stick it back into their belongings and put all their supplies back in it.
In a real life situation, are you allowed to use more than one rag?
Yeah, I had a few sitting there. And it just depends, like if you have a person who's really soiled themselves, then you might need several. But if it's somebody that hasn't been incontinent or anything, if you think about when you shower yourself, like you usually don't use more than one rag. You're just working cleanest to dirty.